I'm going to be talking about the primary outcome findings that we have so far within our current analyses. So as Lori mentioned, the first research question we were looking at was whether our invisible sexual minority women's experience of postpartum depression was different from both heterosexual women and visible sexual minority women. So looking at the time point for 6 to 8 weeks postpartum, we did find that invisible sexual minority women report the highest rates of depressive symptoms. So looking at the Edinburgh postpartum or postnatal depression scale, our invisible sexual minority women reported an average score of 6.9 compared to our visible sexual minority women who reported an average of 5.4 and heterosexual women an average of 4.6. So what we found with our statistical analyses were that the averages that were reported by our invisible group were significantly different from our heterosexual group. So that basically means that our invisible sexual minority women are reporting higher levels of depressive symptoms compared to our heterosexual women at 6 to 8 weeks postpartum. Our visible sexual minority women did not report significantly different rate of depressive symptoms compared to our heterosexual women. So the only difference was between our invisible group and our heterosexual group. We also found that invisible sexual minority women reported the highest rates of depressive symptoms during pregnancy as well. So this overall just indicates that it might not be limited to only the postpartum perinatal period, but invisible sexual minority women may be at higher levels of vulnerability for negative mental health outcomes prenatally as well.